Hi everyone, thank you for joining tonight's webinar. My name is Jasmina Alagic and I'm an accounts manager here at Erchonia EMEA. Tonight's webinar will be hosted by Simone Paul, the founder of the Footlift London Clinic and the Footlift Medical Pedicure, who uses our lunar laser in her practice. Simone Paul is a dedicated podiatrist with a passion for innovative treatment modalities and patient-centered care. With extensive experience in the field of podiatry, Simone serves as a leading practitioner at the Footlift London Podiatry Clinic, where she specialises in utilising advanced technologies to enhance treatment outcomes. We will be happy to assist you at the end of the webinar, which for your reference will be recorded and sent out to all the attendees. I would like to alert you to the question and answer box at the right-hand side of your screen, which you can use to type in your questions to Simone. We will be addressing these questions at the end, but please type them in as we go along. I will now allow Simone to start the webinar. Over to you, Simone.
Thank you so much, Jasmina. And hi, everyone. Good evening. I'm Simone, and I will be presenting a webinar on unleashing the power of cold laser in podiatry practice. And I have my lovely colleague, Rebecca, with me, who is our in-house nutritionist. And Rebecca, if you could just pop your camera on. Rebecca will be joining us a little bit later just to talk about fungal infections and gut health. So what I'm going to do is I'm going to take my camera off. So there's Rebecca. So you'll be seeing her a little bit later. So I'm going to turn my camera off. We're going to start the presentation and I hope you enjoy it. Okay, so we're just going to start off with the first slide. So unleashing the power of cold laser in podiatry practice. So this is a selection of case studies, and I just want to make everyone aware that all clients that we'll be discussing and cases that we'll be discussing, verbal and written consent has been given, and we've been given approval to show the before and after. Okay, so who am I? So my name is Simone. I'm a HCPC registered podiatrist and I did qualify from UEL back in 2011. So my career, it's been a little bit mixed because I spent about 7 years in the Middle East. I set up some practices in Dubai and Qatar. I lived there for several years and I learned a lot about, hot climate and how that can affect the feet. So then when I moved back just before COVID, I decided to start my own kind of self-employed journey. So I started to work at Third Space Medical in Soho. And then gradually we started getting busier and busier with the foot lift, which is a treatment that I pioneered. We then started to work in another practice and rent rooms there. So now we've got 3 different locations. We've got one in Liverpool Street, we've got another one the other end of Soho, and we just started in Marylebone as well. So I formulated some products which you can see here. I still work for the NHS as well, and I'm a Zuki partner. So I'll talk to you a little bit about what Zuki is. They're basically amazing liposomal supplements that you can take, and I do recommend them, and they have helped to support my practice and helps us to get really good results. I've also been a user of the Lumula and the Accelerate for the past 4 years. So I'll be discussing how I use the non-thermal cold laser to prevent and treat onychomycosis, treat the symptoms of chronic and acute foot conditions, prevent foot and nail surgery, increase client satisfaction, and overall improve foot function. So at our clinic, we really like to pride ourselves on the treatments that we give. So the treatments that we give all include our products. We're very, very clinical. We use single-use equipment. And we really want to focus on everything being as clean as possible. So our treatments have been very highly regarded, like from the beginning. So people come in with very, very dehydrated skin on the feet, and they come out and they're really happy with the results. And it's just been such a great benefit to have the laser because it supports our treatment so well. And in my experience, it's proven to be a safe and effective treatment for the management of onychomycosis, tinea pedis, itchy feet, acute and chronic foot conditions, and I incorporate it daily into the practice. Okay, so we're just going to touch on the causes of onychomycosis, and Rebecca will touch on this a little bit later because it is caused by not only external factors but internal factors. So gut and stomach conditions, mental health conditions, peripheral vascular disease, systemic conditions, and diabetes can also lead to onychomycosis. So external examples: bad foot and general hygiene, direct trauma to the nail plates. And as you know, probably the most common fungal pathogens and species that are cultured are trichophyton, microsporum, dermatophyte fungi, but the most common is the trichophyton. Very rarely do I send off for samples. If I can see that the nail is thick, discolored, smelly, then I would recommend that they start laser straight away. Sometimes there is a Pseudomonas involvement as well, particularly if the nail looks very green, but they can go hand in hand, bacterial and fungal nail infections. So what I'm going to do now is just show you a case, and this is a real case that I have been treating for the past, well, it's been over a year now. But this is the foot of one of my patients called Chantal. She's a 38-year-old carer, and she came into the clinic very, very upset. So she's ashamed to wear open sandals or show her feet in public. She doesn't have a complex medical history apart from essential hypertension, which she's on medication for. So what we can see is that all of the nails on the left foot are affected by onychomycosis, and she also had interdigital tinea pedis. So the reason why she didn't come and see somebody before is because she was so embarrassed about the state of the feet. It took probably about 15 minutes for her to take her shoe off because she just didn't know what to do. And it started off with the little toenail, and then the rest of the nails got contaminated like over the course of that year. So she started, so the onychomycosis was present for over 5 years, but she started to get itchiness, almost a little bit of pain, and the strong odor from the nails in the last 2 years of those 5 years. So we brought her in, we did a foot lift for her, which involves cutting of the nails, filing of the nails, clearing of the nails. We also are very passionate about telling the patients that they need to look after their nails and dry them properly and wash the socks on a 60-degree wash. We have a list of advice that we give to the patients. So she had a total of 8 lunula lasers, and there were 4 laser sessions weekly, topical applications, 4 laser sessions. So she would come once a week over the course of 4 weeks. We then had a break in between, and then we did an additional 4 just because the infection was quite advanced. And I was very impressed with the results, but as you can see in the next slide, starting to change a little bit, as that was obviously when we first started. That was halfway through the first set of lasers, and then at the end the nail gradually started to get a little bit clearer, but we did continue with the nail hygiene with the products, making sure you're getting the nails cut and filed by us instead of doing it themselves. And this is the recovery picture. So this picture, just want to let you know that when we start a client off on laser, we ensure that we remove as much of that damaged nail as possible. So it does take time for the nails to grow back. So this is 8 months after her 8th laser session. And as you can see, it's nice and clear, which is really good. And I'm just going to show you another before and after. So as you can see, you've got, it's the same foot. It doesn't look like it, but it is, I assure you. It's completely clear. And as I said, it's the correct nail cutting. It's nail hygiene, drying those nails properly after a bath or shower, ensuring the footwear is nice and clean, making sure that you're avoiding going to, you know, local swimming baths where there's lots of water and there could be a risk of developing further infection. But yeah, I mean, it's been great to see this result without the need for any medication, any oral medication. So we're just going to play a quick video. So just having a look, and she's just going to talk about. Okay, so that's Chantal just letting us know how she feels, and it's been amazing to see the results. So I'm just going to talk to you about another case. So that's Eileen. She's a 41-year-old tech director. And the presenting complaint is that she had a smelly green and black toe following a blunt object landing on the toe. The nail grew back discoloured and began to get painful when exercising. So the diagnosis was very clear, and that was onychomycosis, pseudomonas infection as well, just because there was pus down the side, green kind of pus. And the symptoms were present for 3 years, but it just the nail kept on growing back and falling off and growing back and falling off. And the amount of laser sessions was 6 accelerate laser sessions 1 week apart. Sorry, lunula, that should be lunula laser sessions 1 week apart. And the recovery picture was taken 10 months after the last laser session. So again, we cut that nail back as much as possible. We removed all of the dead tissue, and the aim is to really regenerate the nail as much as possible. It was actually quite painful in the middle of the nail. And as a result of that, we had to be very careful when we were cleaning. You can actually see the redness. So that was actually quite sore in those corners. But we did manage to treat, and clients really happy. The nail is a bit short because obviously it is still growing. But again, we're very, very happy with the result. Okay, and onychomycosis and the effect, you know, on the client. So I've been a podiatrist now for long enough to know that this is one of the most, you know, common complaints. And I think it's important that if you are starting a client on cold laser or lunula, that you manage the expectations. Managing the expectations are really important because they want the fungal infection to go. And I think if you're really upfront with them and let them know that, look, we have to manage your foot care. You know, you may need more than 4 sessions if we're not seeing the results that we want to see. But you can also, you know, show them before and after pictures, but just make sure they know that it's their responsibility as well to manage their feet from a hygiene, perspective. So that's really important. So antifungals, the oral antifungals, they can be very toxic, but it is important to let clients know that there is medication available if they would go to the GP. I don't recommend it in my clinic personally, but it's in the client's best interest that they know about all of the different options, and it's our job to really educate them, on that, and say that cold laser is available. It's a relatively new treatment modality, but it does work very, very well. Okay, so tinea pedis and athlete's foot. So clients that present with onychomycosis often present with mild, moderate, or severe tinea pedis. So, just a second.
I think there is some noise, background noise.
Yeah, there is. Just a second. Sorry, guys. Right, okay, so tinea pedis. So clients that present with onychomycosis, they often present with mild, moderate, or severe tinea pedis. So we've been getting great results with the lunula laser, and it does actually affect the interdigital spaces. So if they do present with athlete's foot, you can advise the client that, they can have laser to treat that as well. So going into the lunula is killing two birds with one stone. So I think that I've shown you those cases to let you know that the lunula truly does work. And I think it's a really good idea in podiatry practice to have this treatment available. So the next part of the presentation is going to be us talking about pain management. So I do specialise in biomechanics as well. So the first case that I'm going to speak to you about, again, consent was gained, is a 41-year-old specialist podiatrist that presents with extreme pain first thing in the morning, constant aching when walking. So I actually used to work with Julie, and she would be limping, and I wondered what was going on with her feet, and eventually she did reach out to me and let me know that she's got really flat feet and she's got pain. We can see in the right foot that the transverse arch has collapsed, that tibialis posterior tendon is elongated, so there was some tendinopathy in there, and unfortunately the pain just got progressively worse. I used to work with Julie a lot, and we used to have to cover CLCH, and that's quite a vast area for walking and domiciliary visits. And it would be a bit of a struggle for her, particularly with the right foot. But both of the feet are flat. Nothing wrong with having flat feet, but it's if there are symptoms that you're getting of pain, then we do need to treat. So the functional pain scale before 3 sessions of Accelerate laser were 8 sessions, and the functional pain scale after 3 sessions of the Accelerate went down to 2. I do want to advise that we did put Julie in orthotics, in customized full-length orthotics with a very deep heel cut, and we gave her some foot strengthening advice and some footwear advice as well. So as you can see, so I've got the older model of the Accelerate, but it still works very well and does the same thing. We are really getting as close as possible to the area of pain, and we're targeting the painful area with the machine. So that's something that you do have to do. You have to follow the protocols, as best as possible. But for this particular case, we used a dermatome and a pain general setting. Okay, so I'm just going down and just actually showing you some of the foot strengthening exercises that have lowered Julie's pain. So it's really important to activate the soleus muscle. I'm really sorry, guys, if you can hear that noise. We're just going to check with the team, but bear with me. Sorry, Jasmina, can you hear anything, or is it just me? Because I'm just concerned about the rest of the people that are tuned in, if they can hear background.
So I don't know where this come from, to be honest. So
Okay.
it's not too bad. I mean, you can carry on. It could be
Okay.
Rebecca's mix. So
Okay. All right, that's fine. Okay, so that's fine. So again, foot rolling, really stretching the plantar fascia, rolling the foot, heel to toe. Heel walking as well is really important with any condition that is related to plantar fasciitis or tendinopathy, really getting the feet activated as much as possible and the muscles around that activated. And as you can see, whilst Julie is doing those movements, we are applying the laser, which is really good. And I think that's how she's been able to achieve these results. So yeah, heel walking, really use the time when you're using the laser to not only do some foot strengthening exercises, but apply and combine the laser with that. And I find that I get brilliant results. So I'm just going to go down. Okay, so again, we're getting the client to lay on her tummy and move the foot backwards and forwards, applying a bit of pressure to where there's pain, the plantar fascia. But the protocols that Erchonia provide are really, really good. And they're all evidence-based and they all work particularly well. Okay, so Julie's just going to talk about her experience and she's going to be very honest about it. Okay, so we're just going to go to another case, and
just to remind everyone.
This is for a chronic condition. So this is my client.
Sorry, Simone, I'm just going to stop you here for a bit. I do apologize.
That's okay.
About that. Yeah, we did. I just want to mention to everyone, to all the attendees tonight, I do apologize. We did have some technical issues with the system tonight, and some of the slides, they might be cut in half and you can't see them properly, and some of the sound behind the video, especially from the last testimonial, I couldn't hear anything myself. I'm sure even some of the attendees couldn't hear that. but we do apologize about that. We will try and send all of the slides to all the attendees, so you can have a look at them at your own time, and you can have a chance even to hear all of those live testimonials from the patients. Thank you very much for understanding.
Thanks.
Thank you, Simone. You can carry on now.
Thank you. Thank you. Yeah, so sorry guys, but yeah, this will all be sent to you as soon as we're done with the presentation. So this is Sandra, 58-year-old scientist. She presented with extreme heel pain in the first MTPJ, Achilles tendon pain, ankle pain, but we actually found that she had a bit of fat pad atrophy. She had severe hallux abductovalgus, intermetatarsal bursitis and Achilles tendinopathy, onychomycosis and hyperkeratosis. So we did bring her in for a course of medical pedicures and foot lifts just to remove the hard skin. She did have some orthotics made, and we brought her in to manage both the fungal nail infection and also the foot pain. So she wasn't able to walk properly. She presented with a walking stick. So actually her functional pain scale before the Accelerate sessions was 9, and the functional pain scale after was 1, which was really, really good. So I don't know if you'll be able to hear it, but there should be captions. No, there aren't. So what we'll do is we'll send you that. But yeah, she's just telling you how much better she's feeling. And as we go down, so this was a really interesting case. So medial and anterior knee pain, unable to play badminton, very, very tight calf muscles. So his main complaint is that he couldn't plank, lunge, and he had pain when he was going down the stairs. So the diagnosis did actually request, because I was looking after his feet as well, that an MRI is obtained, and there was a meniscal tear, posterior cruciate strain affecting the left knee, and the symptoms of knee pain were present for over 6 months, and we were able to just simply hover the Accelerate around the perineals and also the lateral collateral ligament and the patella tendon, and he got really, really good results. I think it's really important with any condition that we advise the client, especially if they're sporty, that they do need to take a bit of a break from exercising, especially while they're on a course of laser. But he had a total of 6 Accelerate laser sessions 1 week apart. Again, I do have his testimonial, but you may not be able to hear it, so I won't share it. I've got another case here, Kira. She's 24 years old. She's a marathon runner, and her presenting complaint was that she had medial ankle pain affecting the right foot, bilateral shin pain, pain in the ball of the foot. She's unable to run and train for the London Marathon. So the diagnosis was intermetatarsal bursitis, which was causing the metatarsalgia. She had a plantar tear, tibialis posterior tendon dysfunction, and chronic ankle instability with weak perineals. So she's a 24-year-old tech manager, so she does have to move and travel quite a bit. But she continued to run, and this is a really good case because we were able to combine the Accelerate and Lunula, even though she doesn't have fungal nails. But the reason why we're doing that is because we want the violet light to actually hit in between the metatarsal spaces, because that's good for toxins. So yeah, her pain levels were a 7. So she went from, you know, having pain when she was walking to work and first thing in the morning, right down to a 2. Again, we did give her footwear advice. We gave her some orthotics and compression socks. Zucchine collagen, turmeric, isometric exercises, stretches, and rest from the weight bearing exercises. And this is me working on Kira. So it's just getting a bit of movement in there. It's really important to ensure that the patients move when you're applying the lannula, because you get better penetration. You're trying to stimulate mitochondrial activity. And applying a bit of pressure is you get really good results when you do that as well. Okay, and it's the same for just the medial malleolus. Really pressing into that area as much as possible. Okay, so that's it in action. And yeah, it's a shame that you guys can't hear this, but that's her. So I don't know if you got that. So Kira's just saying how much better she feels. She doesn't feel pain when she walks to work anymore, which is a really, really great result. And again, I'm putting the foot into the lannula laser to really target those intermetatarsal spaces. I've even used this for clients that present with gout, and it works brilliantly well. Obviously, in addition to, you know, fungal nails and tinea pedis. And we've got another case to show you. So that's Betsy. She's a 58-year-old business director. So her complaint was shooting pain in the ball of the left foot, unable to lunge, walk, or walk on uneven terrain. She was having great difficulty tiptoeing. She was able to tiptoe, but it would just produce that pain. So the diagnosis is that she had a Morton's neuroma between the second and third metatarsal space, and that was on the right foot. Loss of fibrofatty padding as well, so essentially just walking on bones. Moderate hallux abductovalgus and heavy callus that are built up in the ball of foot and also in the rear foot. So I just want to say that if you're going to be using the Accelerate or the EVRL and you're trying to treat foot pain and there's lots of callus in the way, you will get better results if all of that hard skin and that callus is exfoliated and removed. It seems quite obvious, but it needs to be removed because you get better results, you get full kind of contact with the skin, and also the patient will feel much better because there's less restriction where that hard skin was. So yes, she didn't want to go for surgery. Again, we always say in our management plan that that's an option. If you would like to proceed with surgery, then you can get the neuroma removed. But we were able to put her in the lannula as well because it's a forefoot issue, and do 3 sessions of the Accelerate pain, and she felt better. So she's just gonna continue. I think for conditions like this, especially where there's a neuroma present, then you can bring the patients in, you know, every quarter, just do 3 sessions of Accelerate on them, or you can bring them in, you know, once every 6 months or do a top up, but just making sure that the hard skin is removed and that their foot health is improved, and that they're using things like lotion and oil on the feet, and that will allow the feet to feel much better. Again, not sure if you can hear. So she's saying that she doesn't get pain when she's going on hikes, particularly when she's going downhill, and she's feeling significantly better. So that's a really good result. We're just going to go down because I'm aware that time's getting on top of her. So non-thermal cold laser for pain and improving foot function. In my experience, it does work. So it works for all of the conditions such as Achilles tendinopathy, severe hallux abductor valgus and bursitis, intermetatarsal bursitis, tib post dysfunction, tight calf muscles, stress fractures affecting the metatarsals, neuropathy as well, especially painful peripheral neuropathy. I have found that there's been really good results achieved with that. I'm not saying that you can just get the sensation back, but the pain that's associated with neuropathy, if you hover the accelerate on the dorsum of both feet on a dermatome setting, with a little bit of movement, then it can help to improve the pain in the tips of the toes. I also have tried it on patients that have Raynaud's and have suffered with chilblains, and they have reported that it hasn't been as painful after they've come in for laser, which is really, really good. And this is quite a one-off case, actually. So as you can see, it's quite inflamed here, and I've been seeing this patient for quite a while, but she presented with kind of idiopathic wound, scab type lesion on the medial aspect of the malleolus. So I wasn't quite sure what it was. I took a swab. There was an infection present. She did suffer from eczema as a child, but I referred to a dermatologist. And essentially, she has discoid eczema, but it just kept on breaking down. And I thought, if she consents to it, I'm just going to try and hover the accelerate over the area. So we did that. We did some sterile dressings as well. And I'd just like to show you that it started to get better. And I do think it's because of the light exposure. But yeah, eventually it went away. Obviously, the dermatologist was still managing the case, but he didn't want to give steroid injections. But the dermatologist was quite impressed. So accelerate, and I did put the patient in the lunula laser because there was a little bit of athlete's foot. And it has remained like that. And yeah, patient is very, very happy. So it does work. And as I said, I do not have the EVRL, I have the accelerate. And I was able to achieve these results. So I just want to speak to you about our products, because the products work very well. They're all natural, they're all vegan, they're all cruelty-free. And you just get great results. So the reason why I want to show you a picture of, the nails. So those nails are onycholytic, and we want to stop them from turning fungal because there's an air pocket in the nail. So in that case, we would recommend our cleansing and hydrating nail drops. For the feet, this is a patient of ours that did come in for laser. We did some exfoliation for her. But we did use the lunula laser on her feet because it was very, very itchy. And combined with the cream, you do get really great results. So our products, yeah, they've been really highly regarded. They're quite new and they've been around for the past 2 years, but they do work particularly well. And then I would just like to show you that we were featured in Women's Health, or the laser was featured in Women's Health. And this is a writer, journalist that just had a baby. She had an unexplained, kind of spasm and cramping of the feet. So we did bring her in for some foot strengthening exercises. We brought her in for some laser, and she ended up writing an article about it. And she was amazed by the laser. I mean, she was really shocked that after the first and second session, that her pain had improved and her condition. You can read all about it in the Women's Health. On the Women's Health website, but she had developed, she had a plantar tear and also intermetatarsal bursitis. But yeah, she was very impressed with the laser, and that's why she pressed the editors to include it. So that's really good. The Telegraph as well, we're featured in there, and I know it's a bit of a rubbish press clipping. We're featured in there because I do a lot of talks about the marathon, and it was just suggested that if your feet get really, really sore, then you can come in to our clinic and we can not only do a biomechanical assessment, but we can treat your source of pain for you on the spot. So yeah, I just think it's really good that podiatry gets featured in these magazines, because it encourages people to look after their foot health, and it shows a lot of awareness and gives people a little bit of education and advice if they're not able to perhaps come into clinic. So what I'm going to do now, we're just running a little bit behind, but I'm going to pass the mic over to Rebecca. So Rebecca's going to speak to you. We're just really going to summarize everything now. But Rebecca is our nutritionist. She's a great nutritionist. I have been a client of hers. She has had lamellar laser for her nails. And we're just going to mention a little bit about gut health and what you should be advising clients when they are on laser in terms of their diet, because that's also very important. If they're eating lots of sugar whilst they're on a laser course, and opting for, deep fried foods, this can have an effect on the gut, that can have an effect on the toenails. So she's just going to talk to you a little bit about that. So yeah, hope you join, and then I'll speak to you guys at the end. Okay, so Rebecca, over to you.
Good evening, everyone. Thank you very much, Simone. So that was so fascinating, and it's lovely, it's wonderful to have a picture of what you're seeing inside clinic, because it is a different world when a patient walks in and they are coming with like issues that they don't want to talk about, and as a nutritional therapist, normally I'm the one step even later than after someone's going to see someone like a professional like Simone and yourselves as well. So what I've really found is when patients present with foot fungus or skin fungus overgrowth, there is normally years of symptoms presenting before the appointment. And when the patient comes in, I feel it's just so important to see the patient holistically. And I read a really fascinating research paper from the NHS all about how patients really want to be seen as a whole human being, rather than just with this isolated issue that they don't understand, and also they don't know how to achieve a really positive outcome. And when we're talking about things like cravings, refined sugar, lifestyle patterns, and these are patterns that are in full swing, Some patients are very conscious of them, and some are not. So sometimes when I say someone's presenting with a foot fungus or a skin fungus, and we start talking about something that seems very small and very daily, like I don't want to demonize any foods, but say they like a certain food, and it could be a bread, it could be actually a beetroot, it could be anything that particularly calls them, and within that calling, I like to call it anyway, to sort of bring some openness to the conversation, is quite often the food source, and a big food source towards the fungus, because a living pathogenic bacteria, whether it's cultured or not, and you find out the exact name or not, will always have a preferred food source. And it doesn't matter how long the person, the individual, goes without that item, or say is unknowingly drinking, say, coffee that's full of mold, because it's very common, or other foods are full of mold, and it's still deemed as acceptable, and is acceptable. So opening up that discussion is really, really important. So when you've got your patient and you're deciding on your plan with them, and you know you're going to introduce laser because it's so effective, and also the nail oil and foot balms, because that's working on the dermis of the skin, and within 26 seconds, say for example the nail oil or the cream is going to be in the blood system, that's then actively working to cut off the food source. But you can imagine it's from a very small point, but it's very valuable. It's so important, because then when you start improving the gut health by small daily habits, new habits, that if you could ask your patient to commit to 6 weeks of doing, or in between doing while you're seeing them, then they're going to notice when they bring in some more fresh greens, some more fresh vegetables, some more hydration, and they can still have their coffee or their whatever, but as they increase more of the fibrous, colourful foods, and they will feel within their own bellies and within their own system the tingling and the disconnect between the gut bacterias being blocked off to feeding what's alive on the skin, or alive, all the way down the system. Because unfortunately, the funguses won't just be isolated to the feet. They will hide out, and they will do anything to survive. Pathogenic bacteria and beneficial bacteria, as soon as they're out of balance, say for example someone's had too much stress or a foot injury, or they genuinely don't know. I had one patient that genuinely had no idea. She had been brought up in a care home. She genuinely didn't know what it meant to have a loving breakfast, or so she just saw it as an inconvenience to eat because it was stopping her from living. So sometimes getting people to slow down and take that time for nourishment, and nourishment with purpose as well, because when you've got someone that's that has a foot fungus or a skin fungus, it's never going to go by itself. It's going to live dormantly, it's going to hang out as long as possible, and it's going to make as many friends as it can, and as many homely spots as it wants, because it's going to do anything it wants to survive, because we are more bacteria than we are blood. And and that's okay. And also it's very complementary when you start adding in even just say spinach with your eggs in the morning, or if you add in some basil and parsley, coriander into your hummus with your boiled egg on top of a cracker or sourdough bread, that disrupting factor from the greens, from the chlorophyll, from the oxygen, from those greens fibers, that is enough to disrupt the food source going through down into the skin and going down to the foot area, and people can really feel it. And what's lovely about creating an open conversation and seeing someone holistically, even in a 20-minute or an hour conversation while you're treating them, is that sometimes they'll take on the perspective of, oh, okay, there isn't something wrong with me. I actually have a medical condition that I'm going to work on from the inside out to create that positive outcome that they really want to achieve.
Brilliant. Oh, Rebecca, thank you so much. We are slightly running out of time, but hopefully we'll do another webinar and we'll be able to explore more. But yeah, guys, I just wanted to let you know that Rebecca is a great nutritionist and she's been helping a lot of our clients through her advice, through what she suggests. So the food choices are important. Take a full history. What is your client eating? You know, sugars do feed fungus, and you taught me that, Rebecca. So if you're putting clients on a course of laser, just let them know that it's their responsibility to manage everything from an internal to an external environment to the foods that they're ingesting. So yeah, I mean, I do recommend if clients are on a course of laser, they go for spinach, leafy vegetables. And I did not know this before. I didn't really learn this at university. So it's been great. So yeah, Rebecca, I'll just turn to the last slide and thank you so much. And yeah, we can answer any questions after. So yeah, just touching on what Rebecca said, get a full, you know, comprehensive picture of exactly what's going on with the client. Okay, so we're coming to the end of the webinar. I am so sorry if you weren't able to hear everything or see anything. I'm not sure what's going on. Sometimes that happens with technology. But I really hope that you've been able to just get a few bits of information about how effective the laser is and how you can incorporate it into your daily practice, that it is helpful for chronic and acute conditions. And I would be so happy to answer any questions that you might have. You could also follow us on our Instagram page, and you can visit our website. We have an online shop there. I think what I'll do is I'll add Rebecca's email address in. If you have any questions that you would like to ask her, she's, as I said, a brilliant nutritionist. It's really helped a lot of our patients. So yeah, if you need anything, then you can just ask. And if there are any questions, I'll be happy to answer them. Thanks, Jasmina.
Thank you, Simone. Thank you. We don't have any questions at the moment. I hope everybody has enjoyed fantastic webinar, fantastic slides. We do apologize for the technical problems we had with our slides tonight, but we'll try and send it over to all of the attendees. Again, thank you, Simone, for hosting this webinar, and to Rebecca, of course, doing her nutritional side as well, which is really important to find those treatments in order to get the best results out. And just bear in mind, the recording of this webinar will be sent out to all the registrants. So if you do have any questions further down, please let us know. Have a great evening, everyone, and thank you for tuning in. Bye-bye.
Thank you. Thanks, Jasmina. Thank you, everyone.
Thank you very much, everyone. Thank you.
Thanks, Rebecca. Bye-bye.